Hello, and thank you for joining our webinar today, Second Language Learners Eligibility for ELL and Special Education Services. This webinar is brought to you by the Effective Evaluation Resource Center, which is part of Indiana's Resource Network. Today, we would like to welcome Dr. Raquel Anderson. She is an associate professor in the Department of Speech and Hearing Sciences at Indiana University, Bloomington, where she teaches and conducts research in the areas of child language disorders. Welcome, Dr. Anderson. Due to a technical issue when recording our live webinar, we were unable to record slides 1 through 17. Now, most of these slides were just introductory slides for the live participants on how to use the webinar classroom. And welcome, Dr. Anderson. A few of the actual presentation slides are not included in this recording, and that's slides 9 through 17. So when you view this recording, you'll be starting on slide 18 if you've downloaded the PowerPoint. Thank you, and here is the continuation of Dr. Anderson's presentation.
The instrument that is used most often is that of the language assessment scales that give you then some information as to the level of skill of that child, from beginner to fluent proficient, which means that the child does not need then those services anymore. So you have 4 levels to qualify for services: beginner, early intermediate, advanced, and the type of intervention or type of help that the child gets in terms of ELL will be established then based on that. So you'd have a beginner, then you would have the intermediate, would need a specific type of intervention, same for intermediate and advanced. Okay. So establishing those levels is not only do they require these services, but also at what level do they need these services. Okay. The other thing that we need to think about when we're assessing children who are English language learners for services is something that people have talked a lot about in terms of their the child's fluency in English. For what purposes is that fluency being used? So there's that comparison that it's made, and it comes from research by Cummins, in terms of BICS, which refers mainly to basic interpersonal communication skills. So that's the ability of the child to communicate effectively in English in everyday communication or conversation. He can carry a conversation, might make mistakes with the English grammar or not have all the vocabulary, but can sustain a conversation. That compared to CALP, which is related to cognitive academic language proficiency, and that relates to the ability to have the necessary English skills to be able to use that language for learning purposes. Okay? So it's not only being able to talk in the language, but use that language to bootstrap learning, because they have to learn through English in this case. So that's the differentiation that is made. So there needs to be also some type of discussion of where the child is at in terms of his basic interpersonal skills as well as his cognitive academic linguistic skills, which relate more to academic skills. Again, well, BICS, everyday communication or everyday language use. Okay? So those are 2 things that we need to think about. What this comes from is from the whole concept, especially when it relates to academics, that there is this common underlying proficiency, meaning that if you look at CALP, for example, you have that this possibility of the child, whoops, I have to go back, sorry, I got kind of with these stars, I can't do very well. But basically, there is this underlying proficiency. So you have children, if they have, in general, if the child has skills, academic skills in his or her native language that will facilitate the learning of academic skills or application of academic skills in his new language, in this case, English. And that's what they call by common underlying proficiency. So a lot of times also we need to think about when we're assessing children who are ELL is what type of proficiency does this child have in his or her native language, not only in speaking, but also the knowledge, pre-literacy, early literacy in their native language. So what do they bring to school from their native language that would help them then bootstrap? So that also needs to be considered as we're assessing the English language proficiency of that child. So getting some information about what the child brings in terms of his native language into the process of learning, in a sense of school learning. So as I said before, there is some testing instruments that are used to establish levels of proficiency that are used in Indiana, which are the language assessment scales. And there's a lot of variety. And I wrote down McGraw-Hill because that's who is the publisher of that, so that you can, if you want to check their website, but they have a lot of information about those particular tests and also training and how to use these testing. But the most important thing is that the assessment of the ELL should result in identifying, at what level that child is, and also an understanding of not just everyday communication, but also their ability to use that language for learning purposes. And I go back a little bit and suggest that we also need to know a little bit about what the child is bringing from home in terms of his home language skills, which we don't think about that much, but I think is very important for establishing kind of what some of the needs this child might have in terms of accessing literacy and developing literacy skills, and what we need to do to help that child reach that goal. We don't do it that much, but I think that's an important thing to consider. Okay. Excuse me, I'm just getting out of a cold, so my throat gets a little rough. The other thing, kind of switching gears completely, and then I'll let you ask questions, is that when we look at English language learners in terms of special education and IDEA, and again, we all know this as individuals that work with children with disabilities, is that as we're doing assessments, we need to think about these children, that we need to develop and choose assessments and materials that are not to be discriminatory on the basis of both cultural background and racial background, excuse me. And also, I would add, in the next slide, we'll say that not linguistically discriminatory. You also need to have people who are competent, who can evaluate in that particular area of skill or area of concern, be it a speech-language pathologist, be it a school psychologist, occupational therapist, whoever that person might be, but it has to be competent personnel. And that includes interpreters, if we have interpreters in that. And again, as I said, you need to use the language that is most likely to yield the most accurate information in terms of the child's skills. So again, both cultural and linguistic considerations need to be made when we're making decisions as to how to assess a child who is an ELL, So first of all, in terms of procedures, the law states, the federal law states that the assessment should be non-biased, and that's a big term that we've all heard, but it needs to be both non-biased in two levels, experientially or culturally, as well as linguistically. So by experientially, I mean, and culturally, that the procedures that we use to assess this child, as well as the items that are included in some of our testing materials or procedures, are not experientially or culturally biased, meaning that the child is not failing because of lack of an experiential base, but he's truly failing because there is a problem in terms of the child's ability to learn or a skill. So for example, I use this as an example that I always use in my classes again, and it's my favorite joke from The Far Side, who regrettably retired a long time ago. But this is an example of an individual who comes from a particular cultural perspective. In this case, it's Roy, and he is saying hello to a whole bunch of aliens that are coming in who have a head that looks like a hand. And Roy makes the assumption, as I would as well, that if it looks like a hand, it must be a hand. And what do I do to hands when I meet somebody for the first time? I shake them. So what we have here then is this experiential base that is different between Roy and the aliens, and unfortunately we don't annihilate, we don't cause world annihilation, but we could cause some misdiagnosis of skill when these experiential bases are not quite matched. So that's one thing that this is kind of an example of potential bias. Also the items, and I use these because I know what they are because they're from my home country and they're very delicious, but most people don't know. And does anybody know what this is? No? Okay. So that's an example. And I know the word in Spanish, I don't know it in English, but this is an example of something that, from my perspective, it would be something that I could say like this, but quickly, but not quite for other people. And the same as this other item that I eat, and that's in English it's called soursop. But again, a child from my background, this would be an item that they could pick up. They know very young what it is and could identify it. Excuse me. The other thing is, in terms of personnel, it talks about you being competent and competent in your field. In addition to that, the recommendations that are made is that you also need to have background knowledge, not only in your field, in a broad sense, in your area of expertise, be it speech-language pathology, be it educational psychology, be it occupational therapy, and all that includes. But also you have to have a competency in terms of knowing how to perform non-biased assessments. And also, if you're going to be working with a child who is a second language learner, know something about second language learning as a responsibility. You need to understand how languages, more than one language is learned, what are some of the things that you need to keep in mind, what are some of the variables that impact performance, how are these children different, how are the children the same, what should I expect or not from children with these different experiential bases. And obviously, background knowledge in terms of your scope of practice, which in the case if you're working with second language learners, again, this should be within your scope of practice as well. Okay? Others, obviously, you need to have your credentials, and we all know that, your professional background. And again, they also talk about language skill. And obviously in the target language, again, if we go back to IDEA, it says that you should use the language that will provide the best information, which usually is the language in which the child is most fluent. So the personnel who is going to be performing these tasks should have the language skill to complete them in the language in which it needs to be completed. Again, it's whenever it's feasible, and I know that sometimes that's not feasible, but our goal should be always to make it as feasible as possible and to work towards that goal, that it is achievable. The other thing that you need to think about then in the target language is how much skill. And I know for us that are not bilingual, so for example, I am a bilingual speaker, but I become monolingual if I have a child who speaks Mandarin in front of me. So I'm in the same boat as many individuals who are facing the task of working with these children who are not speakers of the child's language. So that's, again, the same issue. So the thing that you need to think about is how well do I need to speak and understand and be able to use the language so that I can test in that language, or if not me, the person that I'm going to use to help me in the process of testing. So those are things that you need to kind of think about as you are making decisions as to assessment of these children. Okay? Then I'll kind of answer this last one and I'll let you ask me questions. But the other thing that is really, that comes back to kind of haunt us, and it haunts me as a speech language pathologist and as a person who works with bilingual children, is that the language of assessment, according to IDEA, again it says in the language, not the languages, but in the language that will give you the best information in terms of the child's ability, true ability. So the question then comes, what do we mean by most proficient? How do we establish this proficiency? And I'm going to talk about this in the second half of this presentation to kind of make a decision that this child, again, knows enough English so that I can test him only in English, or that this child needs to be tested in his or her native language, or what do we do in the case when I don't speak that language and that child needs to be tested. And again, I would argue that you need to get somebody who speaks that language, and that's the requirement by the law, or work around or think of ways that you can assess this child in the most unbiased process possible. My perspective as a bilingual individual, as a person who works with bilingual children, and again, I've seen myself bilingual and knowing that I have varied levels of skill depending on what you're assessing in each of my languages, I always think that if you have a bilingual child or an ELL learner, to me the best option is to look at both languages. And that I would argue for that for two reasons. First of all, the child is bilingual because he is in a dual language environment. He has to speak one language or the other, English in school or in other contexts, and then at home it's another language. And the skills that the child is going to have in each language can be quite variable depending on what they use the language for, with whom they speak, how often they speak it, etc. So by having information about both languages and how this child can interact or can work through both languages, it gives me a much broader view and a more detailed view at the same time of that child's linguistic abilities. And again, I would argue to other abilities as well, processing abilities, etc. So I am of the opinion that I always assess both, and if it comes to the point where I realize that, well, they don't know enough Spanish or they don't know enough Mandarin, that's fine, or they don't know enough English, that's fine. But at least I try to get some information as to his or her relative language skill. So I'm going to kind of give you like 5 minutes for questions, and I'll try to answer them. If you can type them up, I will try to do that. Okay, here's one. What if the language is an African dialect, and how do we address competent personnel and appropriate assessments? That's a really good question. The reality that you're going to have is that for some languages in this country, you're not going to have the large pool of individuals that are that have the background to help you out with this. There are a couple of things that I'm going to go back so I can kind of give you a couple of things that I would recommend. And again, it's going way beyond this talk because I'm talking about eligibility and I can talk about second language acquisition, etc. But I think there are ways of collaborating with other individuals that see this child in very different environments and get a more holistic view of this child's, how this child is functioning in the classroom. And there needs to be a point of talking to the parent. So I don't know if that particular parent also speaks another language that is intelligible, so that you can, not intelligible, but that it is one that you can get somebody who is a speaker of that language or somebody in the community. If we're talking about African dialect, I don't know if it's a language, an African language, or a dialect within an African language like Swahili or Zulu. So that's the thing that I would recommend. So I'll give you a really good example. One thing that happened here in Bloomington was that with our clinical supervisor, bilingual supervisor, was that she had a child whose parents' native language is an indigenous language from Mexico. It's called Tica. She knows nothing about it. The mom is a second language learner of Spanish, so a third of English, and hardly spoke English, and her Spanish was more of a very simple Spanish compared, more of a pidgin or Creole Spanish. And she surfed the web and even checked here at Indiana University, and there's actually in one of the centers here, there is somebody who actually studies that language, Tica, which we never thought. And she was trying to do some type, and I don't know where it ended up, to have some type of Skype interview with somebody who lives there in Mexico who speaks Tica and the other language in English or Spanish, because then our bilingual clinician could have been the interpreter to interview the parent or to work with the parent. So there are a lot of ways that we can go around it. It takes time and it takes effort, but there are ways that might work, and sometimes it might not work. But those are things that she did. And this was a child who was being seen in the public schools, so that there was a time frame that she had to follow. So that, to me, was an interesting way of working through a problem. And also she kind of got information about the language itself. So let me see if I can get another question. I hope I answered this. In terms of the other question is, do you know of any assessments for speakers of Spanish that are non-biased? There are a couple of assessment instruments that are in Spanish. And Spanish is the one in this country that has more of the traditional assessment, at least for speech-language pathology assessment instruments that we're familiar with, like norm reference test. But in terms of non-bias, it will depend on the child and his level of skill in the language, his family background in terms of the potential bias or not. So it would be dependent child to child, the same as an English test. You would also need to look at each child independently. But there are some. The preschool language scale is an example. There's quite a few. There's the SELF. There's the structure photographic, I think, SPELT, that's in Spanish. So there are a couple. There's also some phonology testing in Spanish. But again, the bias would need to be identified for each child individually to see if it's an adequate test for that particular child. Okay, so here's another one in terms of the score low on both languages. And again, the question would be, when you're looking at this in terms of determining either a language impairment or learning disability, would be two things that I would recommend. One, look at the test itself, and it might be that if you're using a norm reference test, is it an appropriate test for that particular child? So what is your comparison? So what does low mean in Spanish? So who are you comparing them in terms of English, as well as in terms of Spanish, or in terms of Swahili, or in terms of Italian, whatever that language might be? That's the first thing that you would need to look at. And then the second thing that people have suggested that you look at, is to look for other alternative testing that might not be one that will tell you exactly what the language difficulties are, etc., but that might give you some more information about other areas such as learning potential, such as a more dynamic assessment. If you look at Peña and Lids, they talk about that and how to apply it both to educational psychology as well as to speech-language pathology, and I would argue for any teaching. and also looking maybe to processing tasks, such as non-word repetition, etc., but those need to be considered on the basis of the child's language skills to make that decision. So, because we know that language does make an impact in terms of those processing skills, because you have to explain things in both languages, etc. So that's how I would kind of go about looking at that. And then I'll do one more. Okay, so the other question basically asks about the bilingual population. So if we have a testing instrument, should testing instruments be for bilingual speakers? So again, here there's not an easy answer, and I wish I could answer them really easy and serious. I wish I could. I would be a much happier person. But one of the things that I will tell you, and I tell a lot of people, is it depends. I think it's important for you to, when you're looking at tests that are normed on monolingual children, there is the possibility that the children will do quite well on these tests, but there is also the possibility that they might not do very well at all. And then you have to decide, why are they doing so poorly? Is it because they're in the process of acquiring a second language, or is there something happening to their native language as they're acquiring English that is impacting their performance? Or are these testing instruments really measuring other skills that are not really what I am looking for? Or that in this particular area, especially vocabulary, monolingual and bilingual children should not be compared, because there's a lot of differences in terms of development of vocabulary, and that's a whole different webinar. It could be a whole 2-hour talk about vocabulary development. But I think, to give you kind of a roundabout answer, and I'm sorry it's a roundabout because it's very hard to answer, is that, again, it depends on the child. There are some tests that are normed on bilingual children, but then at the same time, does your child, what do you call a bilingual? And how do you define a bilingual? And will this child fit within those norms as well? So one of the things that I recommend mainly is that to have an understanding of what can explain some of these differences between monolinguals and bilinguals, and can I explain my child's performance based on that, or can I explain my child's performance on the basis of that there really is a problem here? So that's what we think about. And again, I'm sorry it's roundabout, but you do need to have information about second language learning and some notion of second language learning, especially if you're looking at English, so that you can best interpret the child's performance. And I think because it's 4:15, I'm going to see this I have another one here, and I'll come back to this one at the end. I'll make sure to come back to this one, because it talks about children who have strong BICS in Spanish, but all their help is in English, and assessing in both languages or trying to determine dominant language does not feel equitable, and it is not equitable because of those differences. I think if you're looking at language assessment of these children, and you have a child, for example, who has been learning academic learning, literacy, etc., in English, you would need to really look at that and focus on English. If you're looking at the oral language skills, I think give information about how well the child can do in his Spanish, in his grammar, in his phonology, in his vocabulary, and how he uses vocabulary can give you a good idea of the child's oral language skills. Granted, it's not academic, and it might not be helpful in terms of you're looking for a particular disability that is more reading disability, but granted, that is a reality. But one thing that you could do, and I've done this with some of the children that I've worked with, and I include my daughters here, and I've worked in literacy, is because they started in Spanish but then moved to English really quickly. And even in kids who have had no experience with Spanish, I try to look at how well they can cross over, if you want to call it, to the dark side of the other language and cross over those academic skills. You would not expect equivalent skills, but at least to see if they're able to apply some of the things they've gained, the knowledge they've gained in English to that Spanish. So in terms of literacy, reading in Spanish, being able to answer questions. And I think that will give you some more information. But again, it is not equitable. Many of the kids that I've worked with do come to school with very limited literacy in their native language and pre-literacy, so all they're getting is in English. And I think that also needs to be considered when we are assessing these children, and that's why we need to think about potential for learning as we are making these decisions, and that ability to kind of generalize and to transfer information from one language to the next, especially in academic issues and in literacy, because we do know that there is a common underlying proficiency. And one thing that we do know from the research, both with kids and adults, most of the research tends to suggest that a better predictor of literacy skills in one language is the child's literacy skills in the other language, not oral skills in that language. So again, looking at how well they can transfer some of that information, having that knowledge about what they brought to begin with to the school in terms of the native language might help you make those distinctions and think about the child's inherent ability as related to academic and language for academic purposes. So I hope that answers most of the questions. And I know I wish I could answer a lot of them, but I'll continue and we'll come back to this at the end if I have time to talk more. So continuing, again, as I said before, ELL has particular legal mandates in terms of how to identify children in need of ELL services, and then special education via IDEA has these broad, again, mandates. Each state has different ways of interpreting it and applying it to their own needs, but we do have these two. There are some federal mandates and state mandates that do impact our work with these children. So I'll continue now. And this is just to give you a really example to introduce you to kind of the topic that comes next. And this is sort of a decision matrix that when I started teaching the bilingual language development course to students who are interested in working with bilingual children, they're being trained to work with bilingual children, came up with me, the first group, of how they would like to kind of work through a referral. And I like the way they did it in a lot of ways, and even though it's not perfect, it shows a lot of collaboration among school personnel, which I think is really important. And that's what I'm going to stress, because I think each one of us has a particular area of knowledge that we can share that knowledge and come to really good ways of best serving these children in our school communities. So I kind of brought that up here, this matrix. I know it's a little confusing, but I think the main point I want to make is that there is a process of kind of thinking through what will help us the most at the beginning. What do we do next, and who do we talk to? We confer. We go out and we come back. We go out and we come back. And I think that's what's most important, because, again, each one of us has a different knowledge base. We do have some overlapping knowledge, but we have some expertise, and we can learn from each other a lot. Okay. So the process that you probably go through in school, both for ELL and both for special education, is, first the referral comes in, and there can be two things going on in terms of the referral. And one of the things that can happen is that you are in a school where you have quite a few children who are ELLs, but as a special educator, as a person in the area of special education, you never get a referral. And I don't know how many of you are those. And maybe that makes you very happy because you don't have to deal with that reality. But in a sense, to me, that there's something wrong with that picture, because there might be children who do need our services who are not being referred early enough. It might be referred later on, third grade, fourth grade, when they really start having problems, but are not being referred early enough. So there's this under-referral in our field. And I think that happens in Indiana based on results from the Equity Project for children who are ELL. The flip of the coin might be that you're going to get a lot of referrals for special education of children who are also ELLs, who really don't need to be, who are not eligible, who really are typical second language learners. And again, there's a clink or in the communication, or at least in the knowledge, or in the concern, or in the perceived ability of the individual who's making those referrals in terms of working with that child, and kind of gives that child to you. Then again, that's an over referral. It's taxing on the time, on your time as a person who's doing these evaluations, and has quite a large load of children to work with, caseload. So that again is problematic. But once you get that referral, something needs to be done, and how much of it is done obviously is going to be dependent on the child and your decision matrix and your work, and how this has been established in your district in a sense. But there's a referral, there is an assessment of some sort, and then there's a decision made as to eligibility. And that's where I'm going to stop. I could keep on going, but that's where I'm going to stop in terms of eligibility process. So you get a referral, you got to assess the kid, and you have to make that decision in terms of eligibility. So I'm going to talk a little bit about kind of what the process then requires on your part as on both sides of both the ELL for assessment for ELL and then assessment for special education, and trying to overlap these two, is one, knowledge base on dual language learners acquisition. You need to know a little bit about it, because ultimately you are going to be confronted with making some clinical decisions as to, is this child typical or not? So knowing about dual language learning and acquisition is going to help you place that child within that population so that you can best come to a conclusion if there is a presence or not of a disability. ELL teachers have this knowledge base, so working with ELL teachers, it facilitates the process of making kind of joint decisions as to how to best assess and also how to interpret, help you in the process. Obviously, as a special educator, you're the one who makes the final decision, but using that collaboration can help you coming up, to make the decision as to, is there a language disorder or not? Is there a learning disability or not? But with that collaboration, you can come to a really a more solid or a more confident conclusion in terms of the language, of the skill of that child. The other thing that's important, and it falls within the knowledge base on dual language learners and acquisition, is knowing and understanding both the child's language background and the child's experiential background. So one of the things that is really, really cool about bilingual children or ELL children, and when I talk about bilingual, I'm really talking about dual language learners who can be at different levels of skill in each language. But what's really cool about them is that there's so many potential differences among them in terms of their language background. So for example, you can have a child who the first time he speaks English or hears English really is when he hits the school. Everybody in the home speaks Spanish. He just got to the country and he's there. Or French, or Italian, or Swahili. So this is kind of a new language learner experience. Then you might have other children whose father speaks one language, mother speaks another language, and the siblings speak English with them, so they come to school with some knowledge base. And then you might have where the parents only speak the native language, the siblings, some of them speak the native language, others speak English because they started going to school. So you have a mess, really, a nice mess of a lot of different experiences in terms of the language background. Not just when they started learning English, but also under what circumstances had they been exposed to both languages. And they do vary quite a bit. The other thing is understanding the child's experiential background, as I said before, in terms of academics and home. And one of the questions that was asked related to that, so what academic background did this child bring prior to coming to school, prior to being in your school here in Indiana? What are some of what background? What type of support did he receive? Is this his first school experience? Was he in the preschool? Did he study in his native country? One really interesting tidbit is the correlation or the general trend that children who study, who come to the United States with already some academic experience, and again, that varies quite a bit depending on the true academic experience that the child has had in their home country, is that they tend to do better in terms of academics than kids who start here in this country exposed to only English once they hit school. So it's kind of an interesting thing, again, supporting that whole concept of that common underlying proficiency, that cognitive skill that is going to aid the child in bootstrapping then academics in their second language, in this case English. So they already have something in an intelligible language to them that they can then use to bootstrap as they're learning. That doesn't mean that they will not need help, but that it shows that there's kind of a positive correlation between literacy skills across languages. So having that is really important. And also their home experience, because it does have an impact in what the child is going to bring to school and how well it matches school expectations. And as I said before, you obviously, for a person who is in special ed, knowledge about disability and knowledge about your area and non-biased assessment is essential for working with these children. So I'm going to go back to Maria and kind of give you a little bit of why I used her at the beginning. So to kind of recap about Maria, Maria was, again, she was immersed in English. She had some ELL help. There was an aide in the school when she was in kindergarten. There was some concern in terms of her language skill. And she was tested, as I said before. She was given a vocabulary test in English and in Spanish, scored better in English. The assumption was made that she was dominant in English, had more skill in English, and thus it was okay. The school decided that it was okay to assess this child primarily in English. So a lot of the educational testing was done in English, if not all, and the speech pathologist was bilingual in that particular team. And again, the diagnosis that she received was a mild intellectual disability and a severe language impairment, and she was placed in a special education program, self-contained classroom. When she came to us, she was 11, and for an assessment. The mom's concern was a severe fluency disorder that she was concerned that was not being addressed in the school. And when we tested her, we kind of were concerned. Again, we're not educational psychologists, but we've worked with enough children with intellectual disabilities to kind of suspect that this might not be the case with this child. She was functioning at the level in which she was being taught, so her academic performance matched her at what level she was at in school. She had no Spanish skills left except some, at least productive. She could understand Spanish. Mother could not speak English. And she could try to say some words, but obviously English was her stronger language by that point. We tested her, and again, we did a lot of different types of testing procedures, and we contacted the school, and after our kind of give and take with the school, they changed her diagnosis to learning disabilities because she had improved so much in terms of academic achievement, more so than would have been expected for a child with mild mental disabilities. My issue with the whole case was that this is a child who was 5 years in a special ed classroom for children with mild intellectual disabilities. So she was not getting the type of education she needed. I do not argue that she might have had some language problems, but you don't change a diagnosis. Kids don't change diagnosis. There was something wrong with the picture in the original. And again, to me, it was very frustrating as a clinician to see that this kid, who had a lot of potential, really 5 years of her education was kind of not in her best interest. Great kid. What the problem was in that case, there was a bilingual clinician, so it wasn't an issue that there was no Spanish speaker around to help her out, was that there was a problem in terms of the lack of knowledge of dual language acquisition. They did not consider the family background in terms of monolingual all the time, and that she'd only had 1 year of school experience in English. And they really didn't consider non-biased assessment, especially when you're looking at the types of testing that she was given, especially in speech pathology. So, for example, testing procedures. One of the things that bilingual kids seem to be more different, perform more differently, even adult bilinguals who are fluent speakers of both languages, is a vocabulary test compared to monolinguals. Not because they might not have enough vocabulary, they do. They have a lot of vocabulary in both languages, but because we use languages in different contexts, we might have more skill with the vocabulary or even knowledge of a vocabulary in one context for one language, but not for the other. So in that case, the assumption was made that because she performed better in English and in Spanish in vocabulary, that it was okay to test her in English, when probably a lot of these tests that we give are so based on a lot of academic learning and academic terms that she probably would have performed better in English and not as well in Spanish. Plus, it probably was a new thing for her to be tested in her language in that manner. So there was the initial choice of testing to establish dominance and to establish language skill was problematic. Sorry, this cough will not go away. And so she was misdiagnosed and was incorrectly placed, which again had this kind of significant impact, I think, on her academic performance. Okay. So again, this is only 1.5 hour presentation, and I could talk about dual language acquisition and process, but it's way beyond the scope of the time that I have available. So one of the things that I really want to stress and I want to take home with you, and you probably are doing this, and if not, really look into doing this, is to collaborate. There are children who are ELL and also have disabilities, and we would like to see those. We would like to provide them the best education possible, both from the ELL perspective as well as from special education perspective. One thing that happens, and I'll go back a little bit here, but one thing that happens is if you think of the scoring procedures for identifying children as belonging to ELL, for example, using the language assessment scales, is that a child with disability is going to score low on those tests, as will a child who is just ELL. And I've had anecdotal information from speech-language pathologists, in fact, a week ago in Kentucky, that said they keep on testing them with these tests, and they always score that they qualify for ELL services. And yes, they do, but they're never going to pass them because they are language impaired as well. So again, that's what I mean by having that collaboration, because both people from very different perspectives can look at information and can then come to a good conclusion that's in the best interest of that particular child. So I really do think that one of the best ways of approaching working with ELL children is to have an assessment team that kind of is made up of individuals that are interested in the issues of bilingualism and dual language acquisition and that are needed in the school system where you work, because there are children who speak other languages, because that collaboration would really be helpful because of all your expertise. Special education, the ELL or ESL teacher, any support personnel, be it an interpreter, and obviously the parents and the family are really important. And talking about how to incorporate the family is a completely different topic that also takes time to talk about, especially these families who might feel a little bit detached or not really know how to access the system or the educational system, and some strategies for that. But they should be also an important part of the process. So I think collaboration to me is the key for deciding this eligibility. Again, and I'm sorry I sound like a broken record, but I see this constantly. You do need to have a background knowledge. It's the same thing if you're an educational psychologist and you have to identify learning disabilities. You need to know about learning disabilities. If you're a speech pathologist and you want to know about phonological disorders, you need to know about phonological development. You need to know what is a phonological disorder. I would argue the same thing when we're looking at a dual language learner. You need to know about dual language acquisition. So that's one thing that's really important. You also, each one of you has a good area of expertise. You're experts in your area, and that's why you're working, and you work so well, because you have that background. And I also think that in the decision process, I kind of have the exclamation points. I include the child and what the child's needs are, and considering the child's background and experience really, really central to making that decision. And again, doing that assessment. And I strongly recommend, again, I know that there might be some difficulties with certain languages, etc., but whenever possible, try to get information about how they can deal with both languages, how they are in their native language. And you can do interviews with parents if you don't have the person to help you out with the evaluation, or you can do some very basic aspects with an interpreter to look at particular areas of skill, because it really does help to understand their language ability, even though they might be very fluent in English. I really like to think that it gives me a very, very broad picture of language skill of that child, and in a sense also of other skills related to language, such as cognition. So I think it's really important to be able to look at both languages. And I think also if you're looking at being a monolingual individual working with bilingual children, it's also to have some personnel to support the assessment process. And again, these could be interpreters, and in most instances are interpreters, and again, the whole process of working with interpreters is a different story altogether, and it's, again, a different webinar. But you do need to be aware of having personnel who you feel comfortable with, who have the language skills, who have the interaction skills, and can help you in the process of getting information about that first language and first language skill. And you need to be very comfortable with this identified personnel. I think it's really important to have that and good interpreters to help you out. And lastly, parental input. And I think talking to the parents and knowing what to ask the parents. There are some really good questionnaires that can be given to parents about relative language skill. And again, I'm more than happy to send the references to Virginia, and she can post them that you can use to get information about language skill in the native language, experience with English, etc., so that you can get a lot of information in addition to development and language development in the child. Excuse me. Okay. So some examples of kind of the importance of background knowledge, and I think I've talked about this already, but it's really important if you know something about that child and his or her background, how they've been exposed to English, how they've been exposed to their native language, what learning has taken place in both languages, academic, etc., with whom they speak the language, in what context they speak the language, for what purposes. You can then identify assessment strategies that are pertinent or that are adequate for that particular language. And that's really, really important. Okay? So in terms of choosing the language to test as well as the procedures, having that background knowledge is going to be very helpful. It also is going to be helpful in interpreting results. Okay? One example would be, how do I interpret non-target responses? Is this typical of this child? Is this not typical of dual language learner? I'll give you a really good example that happened to me. I was talking to a colleague who had a child who was a second language learner of English, and the kid had difficulties from the parental information and all the other stuff, and the language was not Spanish, it was another language. And she came and talked to me and explained the way that she would address the decision as to if the child had a problem or not in English. And she looked at the errors she made. And what she told me was, if the errors are not related to the other language, so they're not transfer errors or interference, so it sounds sort of like he's using the sounds of his language in English, or using the grammar or the word order from his language into English, then I consider those as typical errors. But if he makes errors that should not be happening, that are not kind of part of his or her native language, then I'm concerned. Well, the reality is that most of the errors that kids make, both typical and atypical when they're learning a second language, have nothing to do with the native language. So not having that background knowledge, her interpretation of the result was incorrect. Using that to interpret that data was incorrect. In this case, the child did have problems, but that's kind of incorrect assumption, making the assumption that transfer is what guides learning, which we know that that's not the case. So those are then examples of the importance of the background knowledge. Excuse me again. This is horrible. The other thing that I want to kind of address, and this is something that does have an impact when we're assessing, and now I'm kind of moving on to some brief kind of examples of dual language specific aspects that impact performance. One concept that's really, really salient in dual language acquisition is what we call domains of use. By that, we basically mean, a fancy word to say where and when and for what are they using the language. So in what context are they using their native language and their second language? Okay, where are each of the languages used and for what purposes and with whom? And this has a significant impact for assessment. And to give you some really good examples, and that have happened to me as a clinician, one is, and me as a person, one is I might be trying to have the child talk to me about things in a language which he's never talked about them in that language before. So, for example, he doesn't have the vocabulary in that language to explain things to me because he's never had to talk about it in that language. I always use my mechanic analogy where I grew up in a Spanish-speaking country and I knew all mechanic terms in Spanish. Ask me in English, never. And if you were to test me on those as an activity where that's the theme in English, I would have a very difficult time. No problem in Spanish because I've never had to do it. I've always had decent cars here. I didn't have decent cars where I was at, so I did need to know this. Again, when you're talking about particular things, that objects, activities, that might be better known for the child in that language than in the other language. And again, knowing that is going to help you better decide procedures and stimuli to use when you're assessing one or the other language. With whom is also important to understand and where. I've had a hard time when I'm doing bilingual assessments sometimes for children who are dual language learners to feel comfortable speaking in Spanish to me in school. Because from their perspective, that's not the language that is to be spoken in school. So having somebody come in, and these are older kids, not that much the younger kids, and try to get them to speak Spanish in the school with more formally, it's not the interaction style that they are used to, and they're not going to give me the best. And it takes time for them to kind of understand that it's okay, you can speak Spanish to me. So having that understanding is very important. Also with whom? With children, with adults, and all those things also have an impact on how we make those decisions. So that's sort of some examples that I can give you. And again, vocabularies, I stress that because we learn our vocabulary granted in school from reading, but also we learn vocabulary from what we hear or where we're at. And again, depending on where I'm listening and where I'm hearing the languages, I might have very different vocabulary set in kids. Great example that I always use with my Spanish-speaking kids, and I'll say some things in Spanish and I'll translate, are colors. And if you're testing them in Spanish with the colors, or you're using colors for something, and I've had kids and I kind of tell them in Spanish, what color is this? ¿Qué color es este? And they will say, yellow, meaning yellow, and I will say, en español, in Spanish, and they would say, yellow. Why? Because they have no idea as to how to say it in Spanish, because they never have to. They don't have that word in Spanish. So again, knowing that is going to help us, and looking then at vocabulary as a whole, more than just looking at how many English words we can do, or how many Spanish words, or Italian, or French, or, again, Tagalog. So it all depends. So that's really important to understand when we're doing that. And then here, excuse me again, I'm so sorry. One thing that this is another example is just input in that language. We do know in the area of language acquisition that there is a concept of a threshold. So a child needs to be exposed to the language enough to be able to then acquire the language well enough to communicate effectively. And there's a threshold. And all these aspects that I have here impact that threshold. So, for example, how long have they been speaking in that language? How much, okay, do they hear that language? Where do they hear it? With who? How consistent is that use of that language by that individual in that context, for example? And also the type of input, literacy, as somebody asked, oral, storytelling, how is it used? For what types of interactions? And those factors do impact the child's ultimate proficiency in that language. Not just input, but also, let me go back a little bit again, output. Because the parents can be consistently speaking to the child in the native language, but that child might have shifted to responding in English. So you also have to look at how much does the child use that language in everyday interactions, for what purposes. And as I tell people, kids are bilingual not by choice. As adults, we might choose to learn a second language. Kids are not by choice. And they have to use the languages. That's why they're bilingual. They have a community of speakers of one language and a community of speakers of another language. And usually the other language, that is English in this case, tends to overpower that first language, again, depending on a lot of other variables, but tends to overpower. So knowing in terms of how both languages are used and how the child uses each language can again help us understand what the child is doing, his or her performance within that background context, to understand that. So as I said before, understanding how they acquire both languages, and also knowing, again, what we should expect in acquisition in bilingual language performance phenomena. So what are some of the things that we might see in bilingual children that are different from monolingual children because they're learning two languages? What types of strategies would they be showing that are specific to being bilingual because they are in a dual language environment, unlike monolinguals? So for example, what strange things would they do with words sometimes? They invent these words that come from the native language, or they borrow terms from the other language and bring them in. They might code switch or code mix. All those things that are typical, not atypical, in terms of being bilingual and being bilingual learning. So understanding that is really, really important. So to give you kind of an example of two children here, in terms of differences. So I have Carlos and I have Miguel, and both of them are Spanish-English, but both of them have very different histories, and we might see then different performance in school or in English for each one of these children. So for example, you have Carlos in terms of his Spanish and English. Okay, for both cases, both languages are spoken in the home. You have a father in Miguel that speaks both languages and the mom who speaks Spanish. But in Carlos' case, you have the parents that only speak Spanish, but the older siblings are the ones in the home that speak in English to him. So once these older siblings hit school and start learning English, they brought back that English to the school, and most of the play and interaction among siblings is in English. Not atypical. This is typical in many bilingual households. And then you have parents really don't know English, siblings do. And then here you have, with Miguel's father, both languages, mother speaks Spanish. But we don't know how much the father speaks in English to that child. Maybe not, but both languages are spoken. No siblings speak in English. They're younger siblings, and mom is the primary caretaker, so it's Spanish, the language of the home. And while Carlos has been in preschool English only, let's say Head Start or a preschool program, another preschool program, Miguel, this is his first school experience, kindergarten. They're both in kindergarten. So then you have very different children, both in terms of background, in terms of the languages and expectations, which you would expect Carlos to have higher skills in English and have some knowledge and be able to communicate at some level in English. Not perfectly, but to communicate. But with Miguel, you might have a very different expectation. If you look at Carlos and Miguel also, you also have differences in terms of literacy experience. And by literacy experience, I'm talking about the literacy experience that is expected in the school. So those activities, while in Carlos' case, that was the case, in addition to going to preschool, that was not the case in Miguel's household. So then you have two different children in terms of what they bring in terms of transfer from their native language, in terms of these transferable skills that relate to literacy and early literacy development. With two very different kids, and when you are interpreting, you might be giving them similar assessments, but when you're interpreting, you need to kind of put these two kids in perspective related to their language background. Okay. So as I said before, in terms of this is my recommendation, I know that's one of my pet peeves about IDEA that doesn't say this, but I do think that the reality is that we are always in a monolingual mode because we are primarily a monolingual country. Not really, but we are in terms of our frame of mind. We're being taught monolingually in terms of our fields. So we think that way. But I think it's really important that you are working with dual language learners. If you're looking at ability, I think both languages need to be considered when you're making those decisions. Ability in general, in terms of skill. So I think that, again, gives us much more of a comprehensive view of the child's skill level. As I said, proficiency varies. It's a relative thing. And they might be proficient depending on what you're testing and how you're testing it, as I've explained before. And also it's important, and this is, again, based on my own experience and my research, is that you need to be aware of if you're going to be testing in the other language, you need to think about what level of proficiency are you expecting from the person who's helping you, or even if it's you, in testing these children in that other language. What are you doing, and how are you doing that? And I will add to that also, and this is kind of as an aside, that when you're looking at the other language, if you make that decision as a clinician, even though, or a clinician, or a SLP, or an educational psychologist, or a teacher, you do need to really have some knowledge about that other language. And I'm not saying that you have to learn to speak the language in 2 days, these crash courses or Rosetta Stone. No, I'm not saying that. But you do need to have some concept of how that language works so that it can help you as you're making decisions for testing, and also as you're interpreting what the child is doing in that particular language. So I always look it up. I always look, if I have a child who speaks, I had a child who spoke Nahuatl, for example, and I had to look it up and see what is that language like to help me understand a little bit about that child's linguistic background and language skill, and what I would expect in terms of his or her ability in that language. So if somebody was working in Nahuatl and telling me stuff about that language, I could look at it and say, oh, is she doing this? Is she not doing this? Is she doing X? Is she doing Y? And that way I can get some idea as to the level of skill in language, in that language, considering her dual language experience. So I think that's really important. So you should feel comfortable with your level of skill if you are a bilingual speaker in that language, to be able to test effectively, and that the child would respond effectively to you. The same with the interpreter, if you're working with an interpreter, that you feel comfortable with their native language skills or their other language skills, because they might be a native speaker of English. Okay. So revisiting again, as I said, the bilingual assessment team, I really do think that working together is best, and some of you might be working together, but both sides, and I don't like to say both sides because you're joined by the hip, let's say Siamese, that you do have a lot of skills in both areas that can really be used effectively in working with dual language learners. And here I just have some examples of what the ELL teacher would have and the special education. And the ELL knows about second language acquisition, or should have knowledge about that, has had experience working with children, so in a sense that ELL kids, because that's what you do. So you have some basis of comparison to peers, even though it's not perfection in a sense, but you like a score, but you can have this comparison in terms of the child's ability compared to other kids who are in a similar boat, and it could be a red flag. Also can do the proficiency testing in English, and can give information about how that child is performing in that particular classroom in terms of progress towards learning English compared to other children, and also help in kind of evaluating certain assessment procedures that might collaborating and making decisions as to assessment procedures with you, kind of helping you in that process if you are in special education. And then special education with the ELL teacher, you have a lot of knowledge in your area of expertise, be that language, be that psychology, so that you can share that information with the ELL teacher. And you also have a great amount of expertise in the assessment, at least in your particular field, be it language, be it cognition, so you can get that information. You also know about IDEA, so you know the law that kind of tells you, kind of helps you in the process of making decisions. And also disability, understanding what a disability is and different types of disability, and the types of educational programs that are available. So you do have this meshing of two areas that seem to be pulling apart, but really can help each other quite a bit in terms of making these decisions. Because again, if you look at the beginning when I had those two circles, that Venn diagram, you have, again, that area where you're both dealing with the same children, and collaborating is the best way to go to kind of share and pool those resources. The other thing that I really stress, I think parents are really important. I know that it's difficult sometimes working with parents in terms of strategies for them being able to come to schools, to contacting them, etc. But I think they're really important because they do know about their child's development. And we do know that the research that has been done with, at least with Latino children that have been done, and other research with monolingual children, tend to suggest that parents are pretty good at knowing if something's wrong with their kids. And getting that detailed information from the parent is very important. You also get information about the experience in the other language. They might not have a lot to tell you about their English experience, especially if the home is primarily in the native language, but they can tell you a lot about that other language experience and level of skill in that language. And again, if they have any concerns, they can share those with you, and that might, again, be something added to your arsenal of information for making that decision as to if the child qualifies or not. I do want to state, though, and this is an aside that has been my experience with parents, and I think some school districts are working with this very well, is that one of the realities is if the parents are recent immigrants from other countries where special education is not par for the course, they might not have a lot of information about what it means to be in special education. And I've had parents that say, special, yes, I want that for my child. I want something special for my child, without really understanding all the implications that a special education placement might have. So I think it's important for the parents to also be knowledgeable within that team approach of the resources that are available in the school and what each one is for, what the purpose of each of those resources is, because a lot of them don't have a clear understanding because the educational systems might be quite different, and special education has gone a long way in this country, and not necessarily in some of the countries where these children come from. So it's not always clear cut for the parents as to what these different things are, and a lot of times we assume that they understand when they might not have understood. So making sure that they have that background. And I always put the paraprofessional or interpreter. I'm an interpreter myself, so I do strongly believe that you have to have a very trained interpreter, a well-trained interpreter, because they can help you with that bridging communication with the family. Also, if you want to get some information about the child's ability in a particular language, it can help you collect some data on that particular language skill. And it can also be, he or she can also be a cultural broker if that is the case. If they fit within that they are knowledgeable about that community to give you some ideas of things that might be happening, that they might be able to explain it by cultural differences, perhaps. And as I always say, they need to be trained so that you feel comfortable with them and their knowledge, as well as, it's more than 5 with that knowledge. So I'm going to go really, really quickly. I'm sorry, I got carried away. So basically what I'm trying to say is that my recommendations are collaboration, think of alternatives, be bilingual in your assessment, think of other things more than just norm reference testing, because again, we're trying to put Cubism with Impressionism, and they don't fit. And we need to look for alternatives. And granted, I know that administrators say one thing, but we need to effect change at some point. This does not necessarily work with our children, and we need to kind of be more proactive in terms of making some changes in terms of qualification. So I'm going to go really quickly, and I apologize. I got carried away. My thing is collaboration, modifying the testing, knowing about dual language acquisition, and being bilingual, getting in the bilingual mode when you're assessing these kids, or dual language mode, will result, I think, in a correct diagnosis, school placement, and shared knowledge, and that information. So, and I apologize. I truly recommend, I'm going to give you this reading for you to, it's a really good book. It's the latest edition, and it's a really good book because it is very straightforward. And these are individuals that have done a lot of research in the area of second language acquisition, and this might be something that you can, that really kind of summarize the research in the area and talk about literacy and talk about other areas as well and talk about disability. So it's a good book. And again, I'm not getting any royalties from them, so I'm just giving that as a recommendation. And then I don't know if I have time for questions, and I apologize completely, but if you need to reach me, feel free to reach me. I have my email and my telephone number, and I don't know if there's time for questions, and I don't know what Virginia thinks, so I'm going to stop right here and thank you.
That's quite all right. I sent out a chat to the group. If they had any additional questions, they can go ahead and type it in the chat box, and then I will collect those and get them to you, and we'll send the answers out on email to those who registered for the webinar as well as on our website. So hopefully that'll work out. I didn't want to interrupt you. It was all good information, and I figured people who are interested would hang on or watch the recorded webinar when we posted it. So a big thank you to Dr. Anderson for sharing her knowledge with us today, and a thank you to all of our participants for hanging in with us and listening. Yay, she's getting some virtual clapping there. We will be putting the recorded webinar up on the website, so be looking for that. And finally, we really value your feedback. So before you log out, please go to our link that I'm putting in the chat box right now. And when you click on it, it will take you directly to our survey and giving us some feedback for today, as well as the opportunity to request a certificate of participation if you're interested in that. So again, thank you, Dr. Anderson. If you have any more questions, I'll leave this up for a little bit for you to type them. And then when you get a moment, just click on to our link to check out our feedback survey and let us know how things went and future topics you're interested in. Thank you so much.